Hey everyone, so I just wanted to hop on and give an update of this last week of school. So we focused on functional medicine as well as homeopathy. Functional medicine is something that I'm familiar with and kind of dealt with to a small degree previously when I worked my job with Men's Health. A good way to think about functional medicine is looking outside the box when it comes to labs and thinking in an optimal health kind of way versus to limiting yourself to being set lab parameters. So one example that I used with my previous job was in regards to testosterone levels. So for example, say you go to your family doctor and you have your testosterone level checked. And a normal lab range of testosterone would be 3 to 1100. We'll say it was a man that comes in who's 35 years old and the level comes back at 4 to 500. Typically, your traditional doctor would say, well, it's in a normal lab range, it can't be that. I don't think it's your testosterone, you don't need any help with that. Well, with my previous job, we were thinking, well, what's optimal for someone in their 30s? Like, what's an optimal testosterone level? And that would actually be in the 7 to 900 range. And so if a patient were to come in and their testosterone level would be 4 to 500 at that age, we would say yes, you would likely see benefit from testosterone replacement therapy. So essentially, functional medicine, what I find so beautiful is how great they do at taking a patient history and then truly assessing their needs and then looking outside the box when it comes to labs and considering that there's a lot of variability that exists in a lab range. The second portion was homeopathy, something I don't know a lot about, but I'm definitely curious about now, learning some about it. Essentially, the concept is like treats like. So in a healthy person, if you were to take an herb or a tincture and it were to make you feel hot and sweaty and feverish, then the concept would be when you're hot and feverish and sweaty when you're ill, then you would take that same tincture. So the theory is like treats like. So something that would cause symptoms in a healthy person, that would treat those symptoms when the person is sick. So something I'm curious about, eager to learn more about, and thanks for taking the time to listen, and I'll talk to you guys soon.